Hi, Noel Williams, Optimal Health Associates, OBGYN. So, vitamin D 50,000 versus 5,000. 50,000 is once a week. Pretty easy. So, if you're more of a once a week person, you take it with a fat. Again, you always have to take it with a fat. If I have one of the times I'll use it a little more commonly. Let's say I have a big guy, someone who's 200, 225 pounds, 250 pounds, their vitamin D is very low. We'll do 50,000 twice a week for 6 to 8 weeks, recheck their levels, and then go to 50,000 a week. So 50,000 a week, highly effective, rapid change, great for energy, clarity, positive mood. Low vitamin D makes you feel depressed and anxious. Low vitamin D gives you joint pain. Low vitamin D makes you gain weight. So we want your vitamin D high normal, between 80 and 100. That's optimal. That's where we want you every time. So 50,000 units is a choice, and it's some people want to take it once a week. So easier to do. Thank you.